everyone, this is Trevor reporting for Winnipeg Alternative Media, and today I want to talk to you about a class action lawsuit involving multivitamins that contain also fluoride. Endo Health Solutions, they have to pay $15.5 million to settle a class action lawsuit involving their Qualitest Multivitamins with fluoride. The fluoride content advertised on the label is actually 45% lower, which brought on the lawsuit. Shannon Mahoney, she filed the class action lawsuit in December 2015. She says she did not know the dosage of fluoride contained in the multivitamin was lower than advertised, and these multivitamins with fluoride from Qualitest can be prescribed in communities that do not have sufficient levels of fluoride in the water to help prevent tooth decay. The class action lawsuit states that Qualitest multivitamins with fluoride are no more effective than a placebo. The tablets contain a lower concentration than indicated on the label, and the amount of fluoride contained in the multivitamins is lower than the medically recommended dosage. The settlement with Endo Health Solutions was reached August 18th, 1 month after U.S. District Court Judge Denise Cote rejected Endo's bid to dismiss the false advertising class action lawsuit, and the judge dismissed negligence and warranty claims but allowed fraud claims to stand. The Qualitest Chewable Fluoride Multivitamin Class Action Lawsuit is known as Shannon Mahoney versus Endo Health Solutions Incorporated et al., case number 1:15-CV-09841, and the U.S. District Court for the Southern District of New York. And I think it's pretty sad that parents still believe swallowing fluoride is good for teeth. Make sure to watch my video. I'm going to post a link up above for you, which compares Edmonton and Calgary children. And in the study, it showed that Calgary children had better teeth than in Edmonton, even though Calgary stopped fluoridating their water. And I hope that these vitamins and all these other fluoride supplements are removed from the market. And I think it's bad enough that parents are poisoning their babies with nursery water that contains fluoride. I know a lot of fluoride proponents don't like the word poison, but that is what fluoride is. It's a protoplasmic poison, and guess what? We all have protoplasms. And I know that poison's in the dose, but when kids get dental fluorosis, that's the first visible sign they're getting way too much fluoride. And I wish people would stop using the term dental fluorosis and call it what it really is, fluoride poisoning. It's chronic fluoride toxicity. And I urge parents, please don't poison your kids with fluoride. And I would advise not to give fluoride supplements to your kids or give fluoridated nursery water to them. Don't give fluoridated toothpaste as well, especially for very young kids who swallow most of the toothpaste. Buy the non-fluoridated toothpaste like this. Also make sure if you give your baby's formula to prepare it using non-fluoridated water. And the recommended fluoride dosage of water to prevent cavities was based on the fraudulent work of Trenley Dean, the father of fluoridation, or as I like to call him, the father of fluoridation fraud. He cherry-picked his data for his 21-city study and omitted cities that showed no benefit from fluoride on cavities, and admitted this in court under oath. When cross-examined by Frederick Exner, Trenley Dean was sent to investigate dental fluorosis by the United States Public Health Service and was tasked with determining the level of fluoride in water which would not cause this deleterious effect. And Dean was able to show that dental fluorosis became detectable when fluoride concentrations rose over 0.6 parts per million, and at higher levels the severity of mottling rose sharply until at concentrations of 2 parts per million or above. Dental fluorosis became an acute and urgent public health problem. Other researchers have shown dental fluorosis can occur even at lower levels. Trenley Dean characterized dental fluorosis into 4 severity levels: very mild, mild, moderate, and severe. Dean and other public health service researchers surveyed naturally fluoridated communities in order to establish the relationship between fluoride in drinking water and caries incidence. In 1942, he published his flawed and fraudulent 21-city study alleging that the maximal karyostasis occurred at a fluoride concentration of 1 part per million, which is 1 milligram per liter, and as the fluoride concentration in water went up, tooth decay went down, stating that decay decreased sharply from 0 to 1 parts per million and then flattened off. He also noted that 10% of children had fluoride poisoning at this level of fluoride in the water, and that concentrations above 1 part per million did not confer significant additional karyostasis, but did sharply increase the incidence of dental fluorosis. In 1943, the Public Health Service established a drinking water standard of 1 part per million as the maximum allowable fluoride concentration. In 1962, a range of 0.7 to 1.2 part per million of fluoride was recommended, depending on temperature. Lower fluoride levels would be recommended for hotter cities and areas, as the hotter it is, the more water people consume and need. So, as you have learned, fluoride at 0.6 parts per million and lower can cause the first visible signs of fluoride poisoning, yet governments recommend levels higher than 0.6 parts per million because they claim it is good for your teeth, even though 10% of the population will get dental fluorosis. In the United States, it's been shown that even higher levels than 10% of children have gotten dental fluorosis. And in my opinion, you don't need fluoride to have good teeth and bones. Fluoride is not a vitamin and should not even be considered in the same league as them. Fluoride is more like lead and arsenic, a poison. And don't be a fluoron and give your kids fluoride. Take care, everybody. Don't forget to like, comment, share, and subscribe. Bye.